Welcome to Vanderbilt. I'm Chris Lee, the Vanderbilt Neurology Residency Director. I'm delighted you're considering Vanderbilt for your neurology residency training. Like you, we've had to make a lot of changes with social distancing, masks, telemedicine visits, and video conferences for lectures and other educational changes. But there are changes that come and go every year, and throughout all of it, one of the constants in our neurology training is focusing on each individual resident and helping make sure that each person has a chance to pursue their own individualized training goals, which can change even from year to year as people focus on what they want to do next. We have a wide range of people who will help educate every trainee, and we're proud of the kind of breadth and depth we have in all of the subspecialties.
I spend a lot of time with the residents personally. So every Monday, every Thursday, I'm with the residents for morning report, and every Tuesday, I'm with the residents for chairman's rounds. Career development is really a critical focus at Vanderbilt. Most of our residents go on to do fellowships, and so we provide individual mentors, and most of our residents also have informal mentors, and they can always come and speak with Chris or myself to make sure that they're getting the best advice as they develop their careers. One of the things that we've focused on is increasing our presence in the hospital. So we've developed a neurohospitalist service that provides most of the consults in the hospital. And this has really been great for the residents in terms of teaching. We've also increased the number of advanced practice providers in the hospital to reduce some of the clerical burdens of being a resident. And I think it's going really well, and we're going to continue to grow, and I'm really excited about our clinical development.
One of the aspects I like best about this program is the amount of support we get as junior residents working to master the fundamentals of neurology. Whether it's on a busy rotation or overnight call, I feel like our senior residents always have our back, letting us make our own plans and our own decisions, but also supporting us when we need to take our plan to the next level. Over the past 4 months, I feel like I've definitely gained a lot more confidence and a lot more understanding, both in the inpatient and clinic setting. And I owe that to the help and guidance, as well as the support of the faculty and my co-residents here at Vanderbilt.
Hi, my name is Elizabeth Franco, and I am the Administrative Chief Resident of the Vanderbilt Neurology Program. Our program is comprehensive, rigorous, and flexible, giving every resident the ability to explore multiple career paths. As senior residents, we act as junior attendings and have the opportunity to lead and manage our teams under the guidance of our attendings. I plan to pursue a career as a neurohospitalist, and in August, we'll start working as the first neurohospitalist at one of our community hospitals. I'm really excited to have a hand in creating and shaping that program, and would not have the confidence to do this straight out of residency if it wasn't for my training at Vanderbilt.
Hi, I'm Carolyn Germany. I'm a third-year resident. I love seeing patients in our continuity clinic because I'm their neurologist, and they come to see me expecting answers. We also have the opportunity to do toxin injection for migraine and even dystonia. With the support of my attendings, I feel like I've gained the confidence to begin to take care of my patients more independently.
I think one of the biggest strengths of the Vanderbilt Neurology Program is the first year that we're here as part of the internal medicine team. We're fully integrated into their program, and it's a great opportunity to meet all the other residents. The upper years that we work with are so engaging, and they've taught me so much in such a short period of time. Sometimes it is a very big transition from medical school to residency, but with their help, it's been really great. And also, the great part about the intern year here is that you also do rotations in neurology as well. And so you get a month of neurology inpatient as well as being in the neurology ICU. And those are great experiences. You kind of get a break from medicine, and kind of it reinforces why you want to be a neurologist. I grew up in Miami my whole life. I love the city, but I think it was time for me to explore a new vibrant city, and coming here for the interview, that's one of the first things I noticed about Nashville. It's such a great city to work in, and when you finish work, there's so much to do. I love hiking and running and trying new restaurants.
Oh, we have a struggler. It's a 55-year-old female with right-sided weakness, and she's within the TPA window. Great. The stroke alert process at Vanderbilt allows things to run very quickly. I was pretty nervous my first couple stroke alerts, but you always have backup from a senior. And it's really fun because you can often help patients really quickly. So let's go down to the CT scanner because all stroke codes start with a CT head and a CTA. Let's see what's going on. Hi, I'm Dr. Koch with Neurology. I'm gonna have you do a few things, okay? Close your eyes. Good. Look right at my nose. Tell me how many fingers you see. Good. Raise your arm up for me. Hold it up in the air. Hold it right there for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Great. Can you lift your right arm in the air? No, you can't? Okay.
Hey, Corinne, what's going on?
I evaluated the patient. She has a dense right hemiparesis and is aphasic. I'm worried that she has a big left MCA syndrome. I reviewed her contraindications to TPA. She doesn't have any recent surgeries, is not on anticoagulation, no odd bleeding history. Jimmy, what's her blood pressure?
180/76.
And her blood glucose?
120.
Great. I think we're gonna give TPA, but she also may need thrombectomy.
Corinne, you did a great job with this. She's ready to run stroke alerts all on her own, but it's helpful to have the senior resident there as backup, as sometimes these situations can be tricky, and it's helpful to discuss this before talking with the attending.
Hey, Dr. Chaparella.
Hi, Corinne.
This is a 55-year-old female with history of hypertension. She came in with right hemiparesis and aphasia. Her stroke scale was 19.
Okay.
Blood pressure was 180/76 and her glucose was 120.
Okay.
The CT head was negative, but the CTA shows this left MCA cutoff here.
Okay, and we confirmed the last known well and that there are no TPA contraindications?
Correct. No contraindications. She doesn't have a history of atrial fibrillation and she's been in normal sinus here.
Perfect. Then her blood pressure is a little elevated, but we'll continue to monitor it. Let's mix the TPA.
We already calculated the dose and everything.
Looks like the CTP is also up. Looks like a favorable penumbra. I'll call the interventionalist and we'll get this patient down to thrombectomy.
Great.
At Vanderbilt, we get exposure to a wide variety of different procedures. In the EMG lab, we start out by learning nerve conduction studies, and then within 2 to 3 weeks, we're doing our own needle exam with the attending to help guide us. We learn how to do EEGs and regularly read them overnight as seniors, and we do toxin injections for migraine as well as other indications in our clinic pretty frequently. I'm actually going to be going out to practice as a general outpatient neurologist, and I feel comfortable incorporating all of these different procedures in my future practice. So I plan to do toxin injections, EMG, and EEG when I'm out practicing.